السلام عليكم ورحمة الله وبركاته. بسم الله والصلاة والسلام على رسول الله. Dr. Shafiq Mohamed, Emergency Department Physician. It's been 3 days since my last post, and I thought I would bring everyone an update and talk further about some important medical and Islamic issues related to COVID. This information is accurate as of March 19th. Currently, there are 212 cases in Ontario, 70 new cases in the last 3 days. There are a total of 5 cases in Simcoe County, with likely 2 to 3 more probable cases. However, again, I emphasize not everyone is being tested at this time. There are many individuals coming into the emergency department with mild respiratory symptoms that myself and my fellow colleagues across Canada are not testing, and we are asking them to go home and self-isolate due to the limited number of swabs that we have available for testing. Therefore, although we have only 212 confirmed cases, I would imagine this number to be much higher, even as much as 1,000 cases. However, this is just speculation. Right now, it's too early to tell if our social distancing strategies or self-isolation strategies are working to try and flatten the curve, but it's important, as I mentioned in my last video, to understand our resources we have here in Ontario. We currently have 3,000 beds, hospital beds, acute care beds across Ontario. Of these 3,000, the occupancy of these beds is 90%, meaning at any given time, we only have 3,000 beds available for patient admission. If we follow Italy's trend, in 20 days from now, we could potentially have 35,000 cases across Ontario. If out of those 35,000 cases, 11% need hospitalization, which is Canada's current rate of hospitalization. That's close to 4,000 total hospital beds needed. Again, we only have 3,000 beds available across the province, and that's a grossly underestimated number. On a positive note, however, our overall mortality rate across Canada is 1.4%, which is much better than Italy's, which is the highest at 7%. We need to continue our efforts of social distancing, self-isolating ourselves at the onset of any form of respiratory illness, and practicing good hygiene. And of the utmost importance, we need to make sure that we're making dua. Let's talk a little bit about fake news and facts. The biggest spread around social media at this time is whether anti-inflammatories or NSAIDs, which are also known as non-steroidal anti-inflammatories, are harmful to take if you get COVID. Anti-inflammatories are drugs like aspirin, Motrin, Aleve, ibuprofen, Voltaren, just to name a few. First off, taking these medications does not put you at an increased risk of getting COVID. Secondly, there is no sound evidence that these medications worsen your symptoms specifically related to COVID. What there is sound evidence for is that these medications can potentially, and I use the word potentially lightly, worsen any cough, cold, pneumonia, or respiratory illness, not just those caused by the coronavirus. The reason I use the word potentially is that prior to coronavirus, every physician across Canada was advising people with fever and respiratory illnesses to use Advil and Tylenol. Time and further studies will tell us if there is an association between the two. Nonetheless, if you have Tylenol and need it for fevers or pain, and you want to be on the safest side, then take Tylenol. If you have a sore throat and can't stand the pain, and Tylenol is not helping your sore throat, and over-the-counter numbing spray isn't helping either, then take an anti-inflammatory such as Advil. There have been studies that have shown that anti-inflammatories are better for pain relief of sore throat than others. If you have a sore back, if you're dealing with a headache, if you're dealing with menstrual cramps, don't be afraid to take an anti-inflammatory. These are very safe medications when used appropriately. If you are currently on an anti-inflammatory long-term, such as aspirin to protect your heart, or due to chronic pain for which you cannot cope without, or for a specific medical reason intended by your physician, then do not stop taking your anti-inflammatory. Another big myth out there is in regards to holding your breath to see if you have coronavirus and vitamin C supplementation to help prevent and treat COVID. Again, no proof. Ask your grandparents or a smoker or an overly large person to hold their breath for 10 seconds without feeling slightly short of breath. Ask anyone with bronchitis or a chest infection not related to COVID to do the same. They will feel winded. In regards to vitamin C, there has been proof that supplements help to prevent you from getting the common cold and or help you to recover faster, but this is not the common cold. Ideally, use your senses, focus on your overall health to prevent yourself from getting these infections. Are you sleeping enough? Are you maintaining a balanced diet? Are you exercising? Are you moderating your stress levels? Do you have a chronic condition such as diabetes or high blood pressure that you're striving to control using both medications and non-medication means? These strategies, brothers and sisters, will help you, inshallah, in the fight against the coronavirus by ensuring your immunity is ready to stand strong. Going back to the point of Jummah, the committee members and expert consultants have unanimously decided to cancel Jummah prayers at the Berry Masjid, keeping in line with the fact that Ontario has declared a state of emergency. And what that means is, by law, they are telling places with mass gatherings, including places of worship, to stop. This decision from the Berry Masjid is a decision I highly respect. And from one of the most beautiful perspectives, this is being done to protect and preserve our masjids and its congregation. We all need to remember clearly, however, that Jummah is a fard. It's an obligation on every man, regardless if there is a masjid where you live or not, regardless if the masjid is open or closed. The majority opinion states that the minimum number of people needed for Jummah is 3. I would advise you all to ensure that you meet your obligation this Friday and get together in groups of no more than 10. Pray in a well-ventilated space, ideally outdoors. Again, I cannot stress enough, do not join any Jummah prayer if you're feeling sick. Prophet Muhammad ﷺ has clearly stated in hadith, no sick one should be put with a healthy one. He also states, flee from the leper as you would flee from a lion. Last but not least, please stay out of the emergency department unless it is a true life-threatening emergency. If you have a respiratory illness, whether you think it's the coronavirus or not, please do not come to the emergency department unless your symptoms are debilitating and severe. There are assessment centers that have been set up or are in the process of being set up across Simcoe County. But if your symptoms are mild, you do not need to come. If you're finding your doctor's office is not accepting appointments, inquire to see if your physician will do a video or telephone consult. There are many providers who are currently doing this during the outbreak, and as mentioned before, I have made myself available. O Allah, we seek refuge in you from all diseases. We ask you to give us perseverance during this difficult time and protect us all from your anger and to shower us with your mercy and blessings. O Allah, I ask you to give patience to this ummah and let this outbreak be a reflection and reminder for us to bring us closer to you. Ameen.